Ahoy! We haven't shot videos for about 2 weeks. I took a bit of a personal break to bring my family to see my favorite team. And even during that time, there has been amazing progress in ChatGPT and especially GPT-4. ChatGPT was released in November. By January, it had 100 million users. And by March, we already saw the newest iteration, GPT-4. There's a reason why countries like Italy, China, Russia, Iran, and North Korea banned ChatGPT. And there's a reason why tech moguls and researchers called for a 6-month-long moratorium, a pause in the development of ChatGPT, because they are afraid of its future impact on our lives and jobs. But fortunately, there are experts like Andrew Ng from deeplearning.ai that said, please don't do that. Let's, instead of stopping the development, let's focus on adopting quick regulations for these large language models. And it's important to point out that these things have happened for a reason. GPT-4 is 100 times better than the previous iterations like GPT 3.5. So in just 5 months, we went from 1 to becoming 100 times better. Can you imagine about the next iterations and what those will bring to the market? Fortunately, OpenAI announced that GPT-5 is not in the making yet, and they won't come up with anything like that soon, fortunately. So now we have to discuss what GPT-4 can bring into medicine and healthcare and what we can expect from future versions, future iterations. GPT-4 is simply amazing. Since its release in March, I've been working with it daily, literally every day. I can't tell you how many hours I have saved already, just to write an email in a better way than I will be able to do it, or analyze research papers, summarize texts for me, or I include an abstract and ask specific questions about that abstract. It's simply extraordinary. Plus, it will be able to analyze images to tell the content and the context of those images. Like a doctor's handwritten notes could be analyzed by GPT-4, and you could ask questions about it. Not just what's written on the paper, but you could ask questions about the specific medication written on the paper, again, by a physician. It's extraordinary. And if you think about it, that in 5 months, we went from having a conversational chatbot that can answer text-based questions and have a sort of discussion with you, to a chatbot that can even analyze images and became much more sophisticated than the previous versions. Let's think about what the next versions could bring to the market. I think in that order, the next versions of ChatGPT will be able to analyze research papers, uploaded documents, PDFs, then sound, then video. We will go through the whole evolution in that. So I could upload a video and ask questions to ChatGPT about the content of the video, about the images and the video segments used in that media file, and then maybe ask ChatGPT to write a summary in the form of a research document. You can see how many levels we can build into the way we work with this artificial intelligence-based tool. And that's just one thing that we have to expect all these iterations to come out soon, maybe in 1 or 2 years or so. The second is the problem of regulations. Regulatory bodies currently working in medicine and healthcare don't even know which category large language models would belong to. These are AI-based medical technologies, but not devices. These algorithms were not trained on medical data. There are some alternatives like MedPalm 2 from Google that was just released to a few selected customers in working with Google Cloud. But the vast majority of these large language models have not been trained on medical data, therefore they don't have a medical purpose. So it's simple, regulators don't have to regulate it yet. But as soon as medical professionals, policymakers, patients start using it for medical and health-related purposes, regulators will have to do something to make sure that this technology keeps remaining safe and efficient, and some evidence has to be put in the background through studies and clinical trials to make sure that we, patients and physicians, would feel that we can still use it in the practice of medicine and while delivering or receiving healthcare. One more thing, companies started to implement ChatGPT into the core of their businesses. I told you in one of my previous videos that it would happen very soon. And then after a few weeks, 2 companies announced that they started using ChatGPT as the core part of their business. One is that Microsoft's Nuance started integrating it into their medical note-taking tool. And then a French startup called Nabla announced that they would start using ChatGPT as a part of their conversational AI agent while having discussions with their users, their patients. Many other companies like Epic in electronic health records and startups in digital health will start integrating ChatGPT, even knowing the fact that there are no regulations yet in place, not just in the US, but not even globally. In the meantime, if you're wondering how different GPT-4 is from the previous versions for medical and healthcare purposes, ask ChatGPT. Ask it to give you exemplary prompts that you could have given to GPT 3.5 or GPT 3 in the previous versions. And about the same, for example, patient story or patient case, what kind of more detailed, more sophisticated prompt you could use with GPT-4, because that newer version would be able to analyze it and give you the proper response, maybe even helping solve the case. I think what's clear for now is that GPT-4 is amazingly sophisticated compared to previous versions. It took only 5 months to get there. So the future ahead is quite tricky and dynamic. I think what we'll see soon is that new iterations will come out, analyzing videos, sound, PDFs, research documents, and we won't be able to keep up the pace with the development of those large language models. What we need for that is, one, proper regulations and guidelines from regulatory bodies and medical associations, helping us, people working for healthcare, to know the boundaries and the privacy risks and the ethical considerations, and to learn how we can use it safely and efficiently for the sake of patients. And second, we all will need to improve our individual skills. We have to develop a relationship with that technology. And for that, the best thing you can do is to work with it daily. Start to get to know yourself, the tool itself, how you can create better prompts, how you can easily work together. So then this amazing AI tool can support what you do. Large language models and ChatGPT in general won't replace anything or anybody in healthcare, but it could become the best assistant we could have ever hoped for. If you like this video, please subscribe below to get notified about every single new video we come up with. And also please go to medicalfuturist.thinkific.com where you will find our 2 courses, the Digital Health course and our newest one, Introduction to Artificial Intelligence in Medicine and Healthcare. See you there.